In the vast and complex realm of human existence, there are forces that can profoundly alter an individual's natural state. One such force is alcohol use disorder, often known as alcoholism. This is not, as a lot of people assume, a simple matter of choice or a lack of willpower. It is a chronic medical condition. It is characterized by an impaired ability to stop or control alcohol use, despite real-world consequences to health, occupation, and relationships. The individual's brain chemistry begins to change, creating a powerful, compulsive need for alcohol that can override basic survival instincts and rational thought. This disorder reshapes life like a powerful river carving a new, deep canyon. What once was a social activity slowly becomes a central driving need. Recognizing this is the first step for the individual and for the community, a perspective of care, not judgment. Observing the signs of alcohol use disorder is like watching a subtle change in an animal's behavior, one that signals a much deeper struggle. The symptoms are varied, but always revolving around a loss of control. A person may consistently drink more alcohol or for a longer period than intended. They might frequently express a real desire to cut down or stop drinking, but find themselves unable to do so. This internal conflict is a continuous battle between the wish to stop and the compulsion to continue. It is a hallmark of this devastating disease. Their whole life begins to revolve around procuring and consuming of alcohol. They will spend all of their time trying to obtain alcohol, drinking it, and recovering from its effects. Then there's the cravings. Powerful, overwhelming urges to drink they can strike at any time, dominating their thoughts. As the disorder takes hold, normal social activities are often given up or reduced because of alcohol use. Their life begins to revolve about obtaining the next drink. They continue to drink despite knowing the physical and psychological harm it does. A person might be told by their doctor that drinking is damaging their liver, or they may recognize that it is fueling their anxiety or depression, yet still they find themselves unable to stop. When consumption stops or is significantly reduced, withdrawal symptoms can appear, mild or even serious tremors, crippling anxiety, nausea, and the desire to avoid these unpleasant symptoms becomes another powerful motivator, locking the individual into the cycle of dependence. The impact of excessive long-term alcohol consumption on the human body is profound and extensive. It is a poison that over time can damage nearly every organ in the body. The liver is particularly vulnerable. It can become chronically inflamed, leading to fatty liver. Alcoholic hepatitis, cirrhosis, causes severe and often irreversible scarring of the organ. The heart is also at risk. High blood pressure, an irregular heartbeat, cardiomyopathy, weakening of the heart muscle. Beyond the liver and heart, the consequences ripple outward. Inflammation of the stomach lining, ulcers, pancreatitis, a painful, dangerous inflammation of the pancreas. Alcohol interferes with nutrient absorption too, leading to malnutrition and serious vitamin deficiency. The immune system is suppressed, increasing infection risk. The physical toll is cumulative, a slow erosion of resilience. The mind is not spared either. Many drink to ease anxiety or depression. Chronic alcohol use often makes them much worse. It disrupts neurotransmitters, leading to mood swings, irritability, a general inability to cope. Memory and cognitive function are impaired. Blackouts, long-term permanent brain damage and dementia. Their family life is severely damaged too. Family relationships strain and fracture. Trust erodes and responsibilities are neglected. Financial problems from the cost of alcohol. Legal troubles, such as antisocial behavior or driving under the influence. The disorder isolates the individual, cutting them off from support, leaving them adrift in the world as their friends and family keep them at arm's length. The question of why some individuals develop alcohol use disorder while others do not is a complex one with answers found deep in the interplay between biology and environment. Biology-environment. Genetics, it appears, plays a significant role. Just as some creatures are born with traits that make them better suited to a particular habitat, some humans are born with a genetic predisposition to this disorder. Studies of families and twins have shown this. This inherited vulnerability can affect how a person's body metabolizes alcohol or how their brain's reward circuits respond to it. This biological lottery is not the entire story. The environment in which an individual develops and lives is an equally powerful force. Exposure to alcohol at an early age is a critical risk factor. There's a good reason why most societies forbid alcohol to children under the age of 18. The adolescent brain is still developing, particularly the areas responsible for judgment and impulse control, making it more susceptible to the disruptive effects of alcohol. So growing up in a family or social environment where heavy drinking is normalized can shape a person's attitudes and behaviors, making it seem like a natural way to cope with life's challenges or to socialize. Psychological factors also contribute to this vulnerability. Individuals who experience high levels of stress or who have underlying mental health conditions such as depression, anxiety, or post-traumatic stress disorder may be more likely to turn to alcohol as a form of self-medication. It offers a temporary escape, a moment of relief from emotional pain. The process of identifying alcohol use disorder is one of careful observation and honest conversation. For doctors, it begins with screening. This often involves asking a series of simple, non-judgmental questions about a person's drinking habits. How often do you have a drink containing alcohol? How many drinks do you have on a typical day when you are drinking? How often do you have 6 or more drinks on one occasion? The answers to these questions can provide an initial indication of whether a person's drinking patterns are putting them at risk. If the initial screening suggests a potential problem, a more thorough assessment follows. A doctor or a mental health professional will use diagnostic criteria such as those outlined in the Diagnostic and Statistical Manual of Mental Disorders. This involves a more detailed discussion about the 11 recognized symptoms of the disorder which we have touched upon: drinking more than intended, trying to cut down without success. The presence of 2 or 3 symptoms indicates a mild disorder, 4 or 5 is moderate, 6 or more is considered severe. For family and friends, the signs are often behavioral rather than clinical. They may notice a shift in the person's personality, increased irritability, moodiness, defensiveness, especially when the topic of their drinking is raised. There may be a pattern of unreliability, missed appointments, forgotten promises. They might observe a decline in personal grooming and cleanliness, a decline in the upkeep of their home. Secrecy is also a common sign. A person may hide alcohol, lie about how much they are drinking, become angry if their privacy is questioned. Recognizing these patterns is not about placing blame. It is about seeing the signs of a struggle. The journey of recovery from alcohol use disorder is not an easy path, but a varied landscape of treatment options tailored to the needs of the individual. For many, the first step is detoxification, or detox. This is the process of safely managing the acute physical symptoms of withdrawal as alcohol is cleared from their body. Because withdrawal can be medically dangerous, detox is often best managed in a hospital environment or in a specialized treatment facility. Once the body is stabilized, the deeper work of psychological healing can begin. This is often achieved through various forms of therapy and counseling. Cognitive behavioral therapy, or CBT, is a highly effective approach. It helps people identify negative thought patterns and feelings that trigger the urge to drink, and it teaches new, healthier coping skills to manage those triggers. Therapy can be one-on-one, or it can be in group settings where shared experience provides community and reduces isolation. In addition to therapy, certain medications can be an important part of the treatment plan. These medications are not a cure, but they are valuable tools to support recovery. Naltrexone works by blocking the pleasurable effects of alcohol, reducing the reward for drinking. One vital source of long-term support is peer groups like Alcoholics Anonymous. These community networks provide free, ongoing encouragement and accountability. They operate on a basis of mutual support, people helping each other stay sober. This combination, medical support, therapeutic support, and peer support, creates a robust ecosystem for healing. It is essential to understand that recovery from alcohol use disorder is not only readily available, it is a reality for millions of people. The path is not always easy, and there may be setbacks along the way. But with the support of friends and family, recovery is not only possible, it is a fact of life for many survivors of this devastating disease. The human spirit, like the natural world, has a remarkable capacity for healing and recovery. With the right support and a commitment to change, a new and healthier way of life can take root and flourish. The grip of the disorder, though powerful, can be broken, and balance can be restored to the individual's life. The journey begins with a single courageous step, the act of reaching out for help. This can be the most difficult step to take, as it requires overcoming denial, fear, and shame. But it is a moment of profound strength. There is a vast and compassionate network of support waiting to help. Doctors, therapists, counselors, support groups, these resources exist for one purpose: to guide the individual away from the destructive cycle of addiction and back to a place of stability, health, and purpose. Each sober day is a victory, one day at a time is the way forward. Thank you for listening, and please send this video to anyone you think will benefit from it. Also, like and subscribe to keep learning alive.